Question number 5. Risk factors for pelvic floor disorders or nerve damage. Which nerves are affected? Well, there are different risk factors, but the biggest one is having pregnancy and delivery. Vaginal delivery is probably slightly more damaging to the pelvic nerves than a C-section, but just having the pregnancy is a risk factor. The more babies somebody has, the larger their risk factor, but definitely having the first baby is usually the biggest risk factor. Large babies, damage during delivery can cause those things as well. Other things that can influence or have issues with nerve damage are like chronic constipation or chronic straining. That's why it's so important in our field to keep your bowel control better and to try to soften the stool so you're not chronically straining. Lifting heavy objects can do it, but if it's just once or twice here and there, it's not a big deal. If somebody were working at UPS, for example, and they lifted heavy boxes all day long, that could definitely have an impact. The nerves specifically are the pudendal nerve, which comes around the bottom, and it has a distribution to the anal sphincter and some of the other vaginal superficial tissues, including the clitoris. And so when that gets damaged, it can affect bowel control, and people can develop accidental bowel leakage where stool contents do come out and stay in the underwear. And there's a huge range of bothersome for people where it can happen once a month to every day. And you definitely should see us if that's occurring.